Hi, it's Satoru here from Haku Acupuncture Herbs. In this video, I want to introduce you how to take care of your carpal tunnel syndrome. Carpal tunnel syndrome is a condition that causes numbness, tingling, and other symptoms in the wrist, hand, and fingers. It occurs when the median nerve, which runs from the forearm into hand, is squeezed or pressed at the wrist. These nerves control the sensations to the palm side of the thumb and fingers and impulses to some small muscles in the hand that allow the fingers and thumb to move. When the median nerve is compressed, it can cause pain, numbness, and weakness in the hand and wrist. So I'm going to talk about what's the most common cause of carpal tunnel syndrome, and then I will introduce you to how to massage based on the causes. What is carpal tunnel syndrome? The carpal tunnel is a narrow passage located on the palm side of the wrist. It acts as a pathway for a median nerve and tendons to pass through. The tunnel is formed of the wrist bones and contains the different flexor tendons. But because of the injury, overuse, or certain medical conditions like diabetes, pregnancy, arthritis, and even obesity, one or more of these tendons can become swollen, which leads to narrowing of the tunnel, causing numbness and tingling in your hand. Also, some people are born with a smaller carpal tunnel, which can increase their risk of developing this condition. It's important to identify the cause of your carpal tunnel syndrome in order to determine the most effective treatment plan. And one of the most common causes of carpal tunnel syndrome is repetitive movement and stress of your hands and fingers, also known as repetitive stress injury. This condition can be common due to work-related injuries in dentists, musicians, builders, bakers, and even office workers who spend a lot of time typing or using a mouse. Also, people who like to spend a lot of time playing video games, holding a smartphone, and texting can go on to develop the carpal tunnel syndrome. So, extending your wrist for a long period of time and compression can lead to numbness and tingling. Also, continuously using your forearm muscle can narrow the tunnels and cause a problem with the nerves and blood vessels in the hand. According to American Family Physician, 30% of the frequent computer users report undergoing numbness, burning, or tingling in their hands, and 10% of them suffer from carpal tunnel syndrome. For those reasons, you need to release the pressure in your hand and wrist to open up the space in the carpal tunnel. I recommend massaging your wrist, hand, and forearm. I created 6 simple steps to follow and release the symptoms by yourself. Step 1. Wrist massage. In the first step, you massage the actual root of the carpal tunnel called the flexor retinaculum. The flexor retinaculum is the band-like, thick tendon-like tissue that helps to hold the passage of the median nerve, tendons, and blood vessels. There is a crease on your wrist. You can imagine 4 spots around this crease. To massage these spots, place your thumb on the first spot and rub in the circular motion clockwise for 10 seconds. Then move to the second spot and repeat the same motion for 10 seconds. Do this entire process 2 more times for a total of 3 cycles. Step 2. Thumb massage. The second massage is located on your thumb pad. It is also known as the inner eminence. This is a very important point to massage because the median nerve controls this area. You can imagine there are 2 lines on this pad. The first line starts from the wrist crease and goes up to the root of your thumb, which is also known as MCP joint. The second line goes from the center of your wrist crease to the root of your thumb. On the first line, you can divide it into 3 parts and then rub circular motions on each spot for 10 seconds before moving up to the thumb. Similarly, on the second line, divide it into 4 parts and then rub circular motions on each spot for 10 seconds until you reach the root of your thumb. Step 3. Palm massage. This step is important for people who have numbness and tingling in the index, middle, and ring finger because the median nerves also run through these areas. Imagine that there are 3 spots on your palm. The first spot is located at the base of your index finger. The second spot is in between your index and middle fingers. And the third spot is in between your middle and ring fingers. Press the first spot against the joint of your index finger. Find the tender spot and rub it in the circular motion for 10 seconds. Then move on to the second spot and push towards to the index finger for the first 10 seconds. After that, switch the angle and press in the circular motion for 10 seconds against the middle finger. On the third spot, rub the middle fingers against the circular motion for 10 seconds. Repeat this cycle 2 more times. Step 4. Forearm massage. Now, I want you to imagine there are 2 lines on your forearm. Start from the elbow crease and move towards to the wrist crease. The line on the outside is line 1, followed by line 2 in the middle. Then, depending on the length of your forearm, you can divide them into 5 to 6 sections. Place your thumb on the line to massage them and rub them vertically 5 to 10 times before moving on to the next one. Make sure to apply enough pressure but not too much. To avoid pain, if you experience discomfort, you may be pressing too hard. Step 5. Neck massage. Did you know that tingling and numbness in your hand can be caused by having a tight neck? It's called thoracic outlet syndrome. Your neck has these muscles called anterior and middle scalenes, and they have this nerve bundle called brachial plexus and blood vessels running through them. If your neck is tight for any reason, it can trap and pinch nerves and blood vessels, causing numbness and tingling in your hand. To give a neck massage, use 3 fingers to start just below your earlobe. Divide the area into 3 spots and work your way down until you reach just above your collarbone. Use a circular motion and apply a little bit of pressure for 10 seconds. Be careful not to apply too much pressure and cause pain. Gentle rubbing is enough to feel good. Moving down towards your collarbone and repeat this cycle 2 more times. The next spot is located just below the collarbone. If you experience a tenderness when you touch here, it may be due to tightness in your pec major muscle or subclavicular muscle. These muscles can cause pressure on the nerves and vessels in the area. To alleviate this, please rub sideways along the collarbone for 10 seconds and repeat this process 2 more times. The last point is located on the shoulder. To locate it, touch the inside of your shoulder where there is a depression. Inside the depression, you'll find a bone called the coracoid process. This is where the coracoid brachialis and the pec minor muscles attached. When these muscles become tight, you may be experiencing numbness and tingling sensations. To loosen up this point, use your fingers and place them just inside the knot. Rub in a circular motion for 10 seconds. You might feel sore at this point, but that's normal. Repeat this process 2 more times. Step 6. Heat therapy. Before you leave, I have one more recommendation. To relieve tension in your wrist, hand, and neck, I suggest using heat pack or hand bath with Epsom salt. For the hand bath, fill a bucket with hot water at around 100 degrees and add a handful of Epsom salt. Soak your hand in the bath for about 20 minutes to reduce tension in the carpal tunnel and promote faster recovery. To relieve tension in your neck, use a neck wrap for 20 minutes. This will help release the scalene muscle to open up the nerve and the blood vessels, reducing numbness and tingling in your hand. Performing these 6 steps of massage on a regular basis can help speed up your healing process and avoid the need for steroid shots or surgery. But if you're still having trouble with your wrist and hand, you might want to consider alternative treatments like acupuncture before deciding on the surgery to cut your wrist. I hope you or someone you know can recover from carpal tunnel syndrome sooner. Thank you for watching and see you in my next video. Take care. Bye.